Reproductive rights are being determined across the nation right now based on geography. Last week, Kansas sent a resounding message to keep abortion legal in that state.
It's the first test of voter sentiment on abortion, and soon other states will post similar measures, but Oklahoma is not one of them, although there are calls to have that changed. Over the next few days, we will take a closer look at how Oklahoma's abortion ban affects both men and women. Now, here's a breakdown of the laws. The only abortion allowed is to save a woman whose life is at risk. The Attorney General's office tells me there is no exemption for rape or incest. Doctors who perform the procedure outside of those barriers could face prison time or a fine. Citizens can also sue anyone who performs or aids in an abortion. Now, we are starting with abortion providers who are shifting their practices in a post-Roe world. Here's part one of our series, Outlawing Abortion in Oklahoma.
The end of God's good and perfect plan.
God gave you another year.
You know what? I want to know.
Today's the day of salvation. We're not guaranteed tomorrow.
Protests through prayer have been happening here long before Roe v. Wade was overturned. But on this first Saturday since the Supreme Court decision in June overturning 50 years of federal abortion rights, the conversation has ratcheted up.
It's a great day seeing this parking lot empty. Praise God from whom all blessings flow. Praise him, all creatures here below. Praise him above.
All very aware that the law of God is out there, and it commands us unto certain behaviors. We have all fallen short of that. And when we fall short of it in terms of sexual ethics, unexpected pregnancies, undesired pregnancies end up. And then many times people turn to like creating malice in their heart against a child who is an innocent victim, and then they kill that child to get rid of him.
It's like I said, when people get here, they're tired. They're emotional a lot of times, and like I said, having the protesters, lining the sidewalks and yelling at you, sometimes 2 feet away, and having that escort be that safe space between a protester and a patient is crucial.
Oh, it's going.
One of those volunteers is Susan Brazelton.
It makes me extremely sad and angry that there are people that think that they need to force their views of the world onto women that are trying to access their health care.
She was a junior in high school in 1973 when the landmark ruling established the constitutional right to abortion in the U.S.
We've come so far, and yet we have not. I mean, here we are going backwards. And it's mind-boggling.
Let me go ahead and sign this bill.
In April and May, Oklahoma Governor Kevin Stitt signed a series of bills into law banning almost all abortions.
We want to outlaw abortion in the state of Oklahoma.
One of those, House Bill 4327, was written by Republican Representative Wendy Stearman.
So it's very similar to the Texas bill, but it does start at fertilization. For me, that is important because that is when life begins, and I want the state of Oklahoma to recognize that.
Her bill had exemptions for rape and incest, but the current laws don't.
I fully support the removal of those exemptions for a criminal enforcement bill.
There are currently numerous abortion bills on the books in Oklahoma, each addressing it in different ways.
They have a duty and a responsibility to make laws that are easily accessible and for all of us to be able to understand and know what our rights are. And all of our abortion laws and anti-abortion laws do not do that.
Abortion providers are now left navigating this new era.
I can tell you that patients are coming to us scared. They're frustrated that they can't get care at home.
Planned Parenthood is shifting its focus to help patients access care outside of the state.
We have a team of navigators in place, and they are in place to link patients to care wherever that is.
We always did sonograms in here, but also used these rooms for our surgical abortions, and they're not being used right now.
So do you think that another abortion will ever take place in these rooms?
I don't.
When Andrea Gallegos showed us around Tulsa's other abortion clinic in June, they were fighting to keep this location open.
Dark, quiet hallway.
That has now changed.
We began kind of focusing our efforts on moving to a place where we could still be accessible.
Their new location, Carbondale, Illinois, a 7.5-hour drive from Tulsa.
We are asking right now women to become medical refugees of their own state. A state like Texas, a state like Oklahoma, where you can't access care, you're forced to flee your home state.
Gallegos has concerns about what she's leaving behind.
When we limit access to abortion, we're going to see more pregnant women die. These bans don't make abortions go away. Women will still get pregnant and still need abortions. These bills just make that even harder, especially for women of color, indigenous women, women of poor socioeconomic levels.
He's got to come over and spell his religious crap.
God loved you so much, he sent his son to die on a cross for your sins, for my sins, for the world's sins.
Back outside of Planned Parenthood.
We do not want it to disobey the law, even though it's an unjust law, even though it's it doesn't make sense. We are trying to do what we need to do to support women, no matter what.
I want to encourage the churches and those different organizations that can minister to folks that are pregnant, and we can give those folks up for adoption if there are some financial hardships.
Keep your laws off my body!
It's clear the fight is not over, regardless of what side you're on.
Abortion providers and advocates have filed a lawsuit with the Oklahoma Supreme Court challenging the current legislation. Tomorrow, we will take a look at the difficult decision doctors say that they're now faced with when treating pregnant women in Oklahoma and the potential health risks pregnant women could be facing themselves.
Critics fear abortion bans could jeopardize the health of a pregnant woman. We touched on that yesterday in part 1 of our series, Outlawing Abortion here in Oklahoma. But that concern is also felt among some doctors.
They've been left to navigate laws that some say are not clear. What is clear is the reluctance amongst Oklahoma OBGYNs to speak out. Our calls to numerous practices have gone ignored despite multiple attempts over a period of weeks. I was even told there is a reason why no one wants to touch this. But there is one OBGYN in Oklahoma City, Dr. Dana Stone, who is giving us a first-hand account.
There are signs of the pro-life stance across Oklahoma.
The womb is now, in Oklahoma, the safest place for a child to be.
But it's a different story for the doctors caring for those babies in the womb and the women carrying them. Dr. Dana Stone is an OBGYN in Oklahoma City.
We're going to have to talk as a medical team. We're going to have to talk to the attorneys for the hospital system, try and figure it out on the fly. But that is no way to safely practice medicine.
Oklahoma has outlawed abortion except when necessary to save the life of a mother. But nearly 4 months since Governor Kevin Stitt signed a bill into law banning abortion at conception.
So that's something that the doctors are going to make a decision on to protect the life of a mother.
It remains unclear what medical issues fall into that category.
But we need some guidance.
So we asked the Attorney General's office, and we're told that specific examples would have to come from medical professionals on a case-by-case basis.
Well, the doctors will have to figure it out. But we're figuring out with these huge penalties hanging over us.
Those penalties potentially criminal and civil, a $100,000 fine or 10 years behind bars.
There is no punishment for the mother. There is no criminal punishment. There is no civil exposure for the mother. It's for the people who aid or abet or solicit abortion.
A spokesperson for the AG did send us a statement saying, in part, abortion is rarely necessary to save the life of a mother.
This isn't rare stuff for us. I mean, it's maybe rare for other people to hear about, but we deal with this very frequently in our practices. And it doesn't matter how rare it is. Why do we not value the life of every woman? How can we not value the life of a woman when she's pregnant?
Last year, there were over 30 known cases where immediate abortion was necessary to avert the death of the female, according to data from the State Department of Health.
I'm aware of many situations in which that is necessary. I'm not aware of that being an issue in Texas or in Oklahoma since this law has been in effect. So at this point, I do not believe that there is cause for concern.
For the murder of those innocent children, you can scream all you want, but it doesn't change the fact that you will stand before a holy.
In what feels like a full circle moment for the state, another gray area, spontaneous miscarriages.
In 1910, 3 years after we became a state, a law was passed banning abortions. They called it miscarriages at the time, but it's been construed to mean abortions.
Because what we're seeing in states that have banned abortion is that miscarriage management is now being scrutinized. And we're seeing that there are some insurance companies that would not pay for miscarriage management services.
And providers, she says, are afraid to perform the surgical procedures like a DNC to remove tissue following a miscarriage.
And on top of that, if somebody comes to the hospital because they are miscarrying, there's a real concern that they will be looked at differently and questioned and scrutinized instead of being given the care that they need.
There are also questions being raised about censoring speech surrounding care.
We've already had a circumstance in our clinic where a woman called up and she needed that information, and she called us back the next day and she said, I don't feel cared for. I don't feel like you guys care about what's happening to me. And that's not why, we don't want to be that way with our patients.
Could even talking to a patient be considered aiding, abetting, or encouraging an abortion?
Really has put Oklahomans, unfortunately, in a very precarious position because we believe it could violate the First Amendment as well. People should be able to talk to people about health care needs that they may have.
The dilemma for doctors will play out, some fear, with the lives of their patients hanging in the balance.
Telling a patient that, I'm sorry, I can't treat you, you're not sick enough. We have to wait for you to get sicker. I'm in that position where I have to tell a patient, I'm sorry, this is dangerous for you, and these are the things I normally would suggest to you. And my hands are tied by these laws now, and I can't give you the care that I would like to give you that would keep you safe.
Keep abortion safe and legal.
According to the CDC, Oklahoma persistently ranks among the states with the worst rates of maternal deaths in the U.S. As we continue our deep dive into the implications of Oklahoma's abortion ban tomorrow, for the first time on NewsChannel 8, we will hear from an Oklahoman who went out of state in order to have an abortion procedure for a baby she says was very much wanted.
Despite having some of the strictest abortion laws in the nation, advocates stress that care is still available to Oklahomans, but they may need to cross state lines in order to get it.
In tonight's special on Outlawing Abortion in Oklahoma, I will introduce you to a woman who had to do just that. But it's not because she wanted to give up her baby. I learned there's a whole issue with abortions that's not being talked about.
Lori Brown Loftus and her husband were overjoyed at the prospect of expanding their family by giving their daughter a sibling.
We were getting the nursery ready. Obviously, our daughter knew about it. She helped us make the video to announce the birth. She was excited to be a big sister. Our families were excited.
That excitement was shattered following a 20-week anatomy scan in January.
The doctor, said, I'm seeing some things here on the scan that, I'm a little concerned about.
The concern, Brown Loftus soon learned, was a rare genetic disorder.
She basically explained, what that diagnosis meant, that that diagnosis was basically not compatible with life, that most babies don't survive childbirth, and if they do, they don't live much past that.
The Oklahoma City woman was faced with the option of ending the pregnancy or carrying to term and
have to make the choice to choose to have a stillborn. To have to have carried that pregnancy to term would have been devastating.
Even months before Roe was overturned, Oklahoma's laws wouldn't allow her to have the procedure done. She had to go to New Mexico to receive care.
I didn't want to make that decision, but
I don't want anyone else to make that decision for me.
Because of strict COVID-19 restrictions, the Oklahoma City woman had to go through the process alone. Each of the 3 days being met by a barrage of protesters.
The thing that was extremely difficult was the fact that I was visibly pregnant. And there's a lot of assumptions that are made, I think, when it comes to women and abortions. I think there's a lot of times that women who obtain or seek out abortions, that it's a careless decision or that the child is unwanted. And, you know, I think that there's a lot of reasons that women get abortions. And for whatever reason they do, I think it's really unfair to make any assumption about why.
Loftus Brown's story is indicative of a growing trend of families that are faced with extraordinary circumstances, making heartbreaking decisions, left with little choice but to travel out of state.
If we look at places like Oklahoma and Texas, where bans were already in place before Roe was overturned in June, people were traveling not only to, say, Colorado or Kansas, right, states nearby. People were traveling to Washington State and Maryland, so really crisscrossing the country in order to access an abortion.
Nearly 1 in 10 abortions in 2020 were provided to patients who crossed state lines, according to a report by the Guttmacher Institute. That rate is expected to increase, particularly in states that have protected the right to abortion, like New Mexico and Colorado.
Other states may do things differently. Colorado just signed the most egregious abortion bill I've ever seen. Right before birth, you can abort a baby, and it's just unbelievable to us as Oklahomans here how that could get across the finish line in Colorado.
That's not entirely true. In April, Colorado Governor Jared Polis signed House Bill 1279, protecting access to abortion but not changing the laws already in place for late-term abortions. Last month, Oklahoma Senator James Lankford took it a step further by blocking a Democratic bill that would legally shield people from crossing state lines.
The conversation today, it's not just about women. There are 2 people in this conversation. A child with 10 fingers and 10 toes and a beating heart and DNA that is uniquely different than the mom's DNA or the dad's DNA.
Lankford says the legislation isn't needed.
To be very clear, no state has banned interstate travel for adult women seeking to obtain an abortion. No state has done that. Now, am I confident there are some people that are out there talking? Yes, but there's also in this Senate 5,000 bills that have been filed, and how many of them are actually going to move?
As for Brown Loftus, the procedure she had came with a cost financially and an even greater cost emotionally.
I do hope what it does is that it helps even just one person feel like they're not alone. Even just one person feel like they are seen, feel like they have the courage to move forward, to do the right thing, to get the help that they need, to stand up for what's right, to stand up for people that maybe aren't able to.
There are other states that have exemptions to abortion bans for situations like Lori's. Tomorrow, we'll take a look at crisis pregnancy centers, which Governor Kevin Stitt has called on to help.
Oklahoma is potentially poised to see an influx of births in light of the abortion ban.
Pro-choice advocates caution that women who can't afford to go out of state to terminate a pregnancy will need help. But that could also mean more babies born to people who are unable to care for them. There is some support in places to help, but is it enough?
Mothers can make selections of clothing up to toddler 2.
From clothing to diapers and other baby necessities. They've been offering support to expectant mothers at Birth Rate of Tulsa for decades.
We try to offer hospitality, hope, practical solutions to parenting and getting started with pregnancy.
Regardless of the circumstances surrounding the pregnancy, says Executive Director Connie Sullivan.
Everybody's welcome if they are struggling with an unplanned pregnancy.
Or in this post-Roe era, potentially forced pregnancies.
Most of the women who come to us want to be moms, but they need some help. But if you had somebody that was really conflicted, yeah, they may come and you may discover through your conversation with them that this is an especially tough decision for them.
And that help is potentially needed in the very near future more than ever before, with almost all abortions banned in Oklahoma.
We may very well get women who, wanted to make a decision to have an abortion, and they realize, well, I'm not leaving the state. Maybe I can do this.
Last year, the center had 1,400 visits and is bracing for more.
Do you see an even greater need? And, is the center prepared for that?
There's nobody that's paying any attention that doesn't realize that, number one, there's always going to be women struggling with unplanned pregnancies, and that there are, means to help them, but that those different organizations also need to be supported.
According to a study from the Annie E. Casey Foundation, Oklahoma ranks in the bottom 10 states for child well-being, with 1 in 5 children living in poverty.
Whether it's a food stamp program, whether it's Medicaid, any number of those things, it's limited. And so you're looking at maybe the first year of the child's life, you're getting some support. But after that, essentially, the state of Oklahoma says you're on your own.
The Center for American Progress estimates 55% of Oklahomans live in a child care desert. That's an area with little or no access to child care.
It's a logical conclusion that an already overburdened foster care system is going to be burdened even more.
But a spokesperson for the Department of Human Services doesn't think so, declining our interview request and instead suggesting talking to an adoption agency would be more appropriate. State Representative Brian Hill, who's been a foster parent before himself, is among those calling for a review of the system.
This study is also important to make sure that if we do see another increase in foster care, that our system is prepared to provide those services.
Data provided to NewsChannel 8 shows nearly 10,500 children were in the care of DHS within roughly the last year. That's an improvement from the year before, and that trend of fewer kids in care has repeated each year, dating back to 2018.
We've made monumental strides.
The state is also creating a task force that Governor Kevin Stitt says will assess and come up with supports for mothers during and after pregnancy.
It is a bold step forward, something that those in the pro-life movement have been working on for a very long time.
A large component is anticipated to be crisis pregnancy centers, or CPCs. There are more than 2,500 of these centers in the U.S., vastly outnumbering Planned Parenthood facilities, according to analysis by the research arm of the anti-abortion group Susan B. Anthony Pro-Life America.
Pregnancy resource centers in particular, which in Oklahoma outnumber Planned Parenthood's 38-1, have been on those front lines for many, many years.
According to the Associated Press, based on state budget figures, nearly $89 million has been allocated to these centers in about a dozen states this fiscal year, including Oklahoma.
CPCs often lure women seeking legitimate reproductive care, including abortions, into their facilities by advertising themselves as comprehensive reproductive health care providers. But this is flatly untrue.
There are critics that do say that these pregnancy centers exist for the sole purpose to try to dissuade women from getting abortions. What is your reaction to that, or what would you say to those folks?
Yeah, well, I would first say that that's not true. The role of pregnancy centers is to empower women with authentic choice, to show them what is the reality going on inside of them and the life growing inside of them.
Andrea Swartzendruber is an associate professor in the Department of Public Health at the University of Georgia.
It can be often difficult for people to identify
what is a health facility, what is a crisis pregnancy center. They often appear like they offer services that they don't actually offer and actually oppose, like contraception, like abortion.
Not one of these CPCs in Oklahoma is a licensed medical facility, yet some have names that could be interpreted that they are.
They target, in particular, young people, people with low incomes, and people of color. They are opposed to abortion, and many times they don't make that abundantly clear, and they're less than transparent about their religious affiliations.
Not all centers that help pregnant women engage in these tactics. Back at Birthright of Tulsa, Sullivan is calling for the community to come together.
So it's this ripple effect of we will work together for the sake of these women in need.
Part of that, she says, through donations. But Sullivan hopes Oklahomans open up their wallets and hearts.
I just want to convey the message that, you know, the pregnant woman and the child she's carrying should be wanted. They should be loved. They should be cared for. But that's going to take a lot more than just flying somebody in an airplane to a hotel in California to have an abortion.
In tomorrow's conclusion of our series, we will look at if the vote in Kansas to protect abortion access will have any influence here and why some people are switching their birth control options.
The future of reproductive rights is playing out in real time across the nation.
The overturning of Roe versus Wade has potentially opened the door to other rights being rolled back, like access to birth control. Tonight, I take a closer look at contraception, the permanent options some people are taking, and how the vote in Kansas could indicate the direction that Oklahoma might be heading.
The raw reaction to a result in a reliably Republican state.
We did it! We did it! Yes! Oh my God!
59% voting to uphold abortion rights in Kansas.
I think many Kansans have also woken up to this moment and said, you know, I wasn't particularly interested in abortion rights, but I really never thought that Roe could fall.
Since that happened, Kansas has become a key abortion access point for Oklahomans.
As governor, I represent all 4 million Oklahomans, and they overwhelmingly support protecting life in the state of Oklahoma.
But it remains to be seen if that's the case or if an outcome would be similar to Kansas if put to a vote. A recent Gallup poll shows 55% of Americans identify as pro-choice. The support jumps as high as 84% for abortions for pregnancy caused by rape. The Attorney General's office confirming Oklahoma does not have an exemption for rape.
We as a government are forcing people to essentially parent a child with their rapist.
And while the Supreme Court's ruling on Roe v. Wade doesn't directly impact access to birth control, there is a warning shot that's creating confusion.
We've seen an increase in patients looking for long-acting reversible contraception like IUDs because they are concerned contraception will be next.
In his opinion, Justice Clarence Thomas writing the court should review other precedents, including the landmark case protecting birth control.
Now that abortion rights have been overturned at the federal level, we're expecting states to start looking at how they can limit access to contraception.
Last month, the House passing legislation to protect access to birth control. Voting against it, all 5 Oklahoma representatives. It remains to be seen if it will get the support of 10 Republicans needed to pass the Senate. Meanwhile, at the state level,
right now the law does not ban contraception. The law picks up from fertilization. But the question of whether it will get anywhere else is a question of policy for the legislature. We'll enforce the law that they pass and that the governor signs.
Some retailers have already set limits on forms of contraception like Plan B. And while not the same, there are reports of people stocking up on abortion pills.
8access.org is an overseas telehealth service that is run by a physician who believes that everybody has the right to access these pills. She will do a medical consultation with you. It's all done online, so there's no video visit. You fill in your medical information. She will review it. She will write a prescription, send the prescription to an Indian pharmacy, and the Indian pharmacy will ship you generic medications to take at home.
Self-managed abortions are banned in Oklahoma, but Plan Plan C, a nonprofit abortion advocacy website, says there are workarounds.
We also highlight that when you search on Oklahoma on our website, the first thing you'll see is that Oklahoma does not allow pills by mail, but we know that access is still possible.
Natasha Cryer isn't taking any chances.
I knew that I was just done having children, even in my pregnancy. But then, after seeing the Roe v. Wade leak, I didn't want the possibility of possibly falling pregnant.
At the beginning of June, the 27-year-old took permanent steps to ensure becoming pregnant was no longer an option.
Basically, my tubes were removed. Okay. Completely.
The interest in procedures like tubal ligations, Dr. Dana Stone says, are up.
One of my partners said, I will usually do one of these a month, and now I'm getting 1 or 2 people a week that are asking about this.
But those seeking out sterilization could face serious barriers.
I was told no multiple times throughout the course of about 4 years whenever I was trying to get sterilized to begin with.
And what would those doctors say to you?
That I was too young, I didn't have enough children, you know, you could change your mind, or even this one, what happens if your child dies?
Regret and age are also reasons why doctors typically turn patients away. That applies to both sexes.
If someone has not had children and they're not married and they want to get a vasectomy, you really have to have a good conversation with them, because you need to look at this as being a permanent form of contraception.
In the rush to get vasectomies post-Roe, a Tulsa clinic says it booked 49 consultations in one day.
It's a big deal to get them reversed, and it's not 100% successful.
In May, Democratic State Representative Mickey Dolan suggested reversible vasectomies in a tongue-in-cheek proposal.
Then I would invite you to co-author a bill that I'm considering next year that would mandate that each male, when they reach puberty, get a mandatory vasectomy that's only reversible when they reach the point of financial and emotional stability.
He says it was meant to serve as an example that government shouldn't regulate anyone's reproductive systems.
We know this is a critical part for people's reproductive lives and lives in general as they decide how to plan their own families. And we need policymakers' policies that they enact actually match up with that reality.
As for Cryer, she says since her surgery, she has peace of mind.
I feel almost empowered now that I do have full control over my reproductive health.
And that is the conclusion of our week-long series. You can find all of the stories posted on our website, KTUL.com. And if you would like to share how the abortion ban has impacted you, please email us at news@KTUL.com.